It's time to remove your breast implants. What should you do? That's the question. Should I remove them and don't put any more? Do a breast implant explantation? Or should I change them? Hi, I am Dr. Lina Triana, and I'm here to talk about what to do when it's time to change my implants. If I decide to remove them, what will be my recovery after breast implant explantation? According to FDA, breast implants must be changed every 10 to 15 years. So when time comes and the woman has to take that decision, many times it's a little bit of anxiety that follows. Should I take them and do a breast implant explantation and go through a reconstruction? How do my breasts will look? Or should I change them? It's important always to listen to the patient and after that advise what can and cannot happen so that she takes the right decision. If you have only implant when you touch your breast, if you take it out, it's gonna be nothing left there. Although I will help you with a reconstruction, taking a little bit of muscle and tissue around. But remember, once you put a breast implant, the breast implant, years of being that breast implant in your chest, will produce atrophy on the muscle and the breast tissue, meaning you will have less than when you put your breast implant. Plus, with age, you lose breast tissue and it's changed with fat that is floppy and not of a good consistency. So again, if you don't have a lot of breast tissue and you don't want to lose your cleavage, then you can have second thoughts of doing a breast implantation and change it for a smaller breast implant. But still, if there is loose skin, you will have to do a scar. That can be more or less an inverted T or an L. If you, by the other hand, think that now it's time for a change, that for you the cleavage is not anymore important, that the scar it's okay with you, you can go ahead and go for a breast explantation. What is a breast explantation? A breast explantation is when we take the breast implant out and nothing is put back there as an implant, meaning that we will have to do a reconstruction. I will have to seek for some tissue left and of course some of your muscles to recreate some kind of a cleavage. But remember, it will always be smaller than when you had the breast implant. Important to discuss with the patient what will happen with that breast scar tissue around the implant. That is called the capsule. Many doctors promote a total capsulectomy, meaning that they take all of that scar tissue out, saying that that will prevent future symptoms related with Asia disease or BII, breast implant illness disease. Studies has been done where it says that there's no difference in taking away the whole capsule, in block capsule extraction, versus leaving the capsule in. Myself, personally, I do like to take all that breast scar tissue out. I like to take the capsule out. I do believe it gives me better recovery results. But still, again, there are scientific papers that say that there's no difference if you take it out or not. What is a breast explantation for Lina Triana? It's much more than just taking the breast implant out. It's trying to deliver the best result for the patient. How? Taking the whole capsule and after that, looking into what tissue she has, taking advantage of her muscles, nearby muscles, to recreate as much as I can a good cleavage for the woman. Remember that the difference between a male and a female is the cleavage. That's the main reason why she ended up having a breast implant years ago. Doing a breast explantation is much more than just taking away an implant. Losing a breast can be a big challenge for us women. I personally have experienced a breast tumor, and having a breast tumor and getting into the OR without knowing how you're gonna get out, if you're gonna lose your cleavage, what really makes the difference between female and male, it's a big challenge. So I do understand those women that want to take their breast implants out but are not sure if they should do it or not. My advice would be, if it's the time to do it, if the cleavage is not the most important thing for you, if you think that maybe it can work towards decreasing your ASHA symptoms or BII symptoms, breast implant illness symptoms, go ahead and do it. But remember that although I will do the best to do that reconstruction, to leave some kind of cleavage, I can never promise that it will look as nice as it was with the breast implants. So I hope I have given you a good picture of what to do. Change my implants or do a breast implant explantation. If you still have more questions and want more answers, go ahead and ask a virtual appointment or go for more information at www.drlinatriana.com. And don't forget to follow us in our social media and subscribe to our YouTube channel.